as a patient, you want to know that you're getting a standardized level of care. That whatever, when you're vulnerable, you go to a doctor, you go to an allied health worker, you get care that is standardized and that is what you need clinically. As a caregiver, you want to give the best care possible for your patient with whatever resources you have. The problem that currently exists, and this is based on the opinion that I've formed from all these observations of many important people who have done Senate inquiries and reports and research on this material, that there is a bit of a process issue. At the moment, clinicians are not clear about what exactly it is that they are providing in regards to care versus what they are getting paid for. So there's a bit of a discrepancy in the process. It's almost basically the best analogy is you're driving, but you're never told what the speeding limit is, and then you're fined for overspeeding. That's exactly what it is. So then when you're fined for speeding, but you don't know what the rules were, it's not fair for the clinicians. And what that unfairness happens is it actually breeds a bit of fear, a bit of anxiety, and it seems like the people that suffer the most are the patients, because the patients are subjected to clinicians potentially that are going, oh, I might not want to do that, let's say, electrocardiogram, ECG of the heart of your mother, let's say, who is a diabetic and turns up with a bit of chest pain. Oh, but you know what, I might not do the ECG because guess what, I might get audited for that. So, but later on that night, she ends up in the emergency department because the doctor didn't do that. Is it the doctor's fault that they didn't do that? Was it clinically indicated, not indicated? All these questions are there, and it's because of the lack of standardization, lack of clearness. This case is just about asking the government to clarify that, whether they can just clarify that what it is that they're expecting and what is the minimum standards. That's it, just a fair go for everybody. Basically, how can you help? So 3 ways. Like the page, first up, if you can, to spread the word. Share it, obviously, which is going to spread it again. The other option is make some donations for us. What we're trying to achieve is a prevention. We're trying to, basically not waste money in the long run for a better healthcare system. So if you can, whatever you can contribute, please contribute. And there's options to be able to contribute. Doesn't matter about the amount, it's more the gesture. And contribute what you can so we can actually work towards building a team who can help us achieve this. That's basically what we're trying to do.